We are live for our event today. My name is Leanne McAllister. I am the Executive Director of the Nevada chapter of the American Academy of Pediatrics, or we call Nevada AAP for short. Hello to all the parents, kids, and pediatricians joining us today. This is the May 2020 Walk with a Doc Kids Time. For nearly 6 years, the Nevada AAP has been meeting the second Sunday of every month in Las Vegas to talk about a wide range of pediatric health topics, and then take a walk together. Just admitting people from the waiting room while we're talking. The Nevada AAP also coordinates a walk for the Reno community. Here in Las Vegas, we used to meet every month for most of the year at the beautiful Springs Preserve, except for June to September when we headed up to the amazing Mount Charleston Spring Mountain Visitor Gateway to escape the extreme heat of the Las Vegas Valley. Today is Sunday, May 8th, 2022. And as we are still waiting for a COVID vaccine for children under 5 years of age, we are modeling keeping our distance to protect ourselves and our community from the coronavirus by holding this statewide virtual event. By keeping kids from different child care and school settings apart, we are slowing the spread of COVID-19 in our community. We absolutely want you and your families to get outside for a walk, but until everyone in your family is up to date on all vaccines, we recommend avoiding crowds. For today's virtual event, we welcome Dr. Lily Hadaji, a pediatrician at Oasis Pediatrics here in Las Vegas and the Nevada AAP Walk with the Doc coordinator. Dr. Hadaji moved to Las Vegas in 2008 as a pediatric resident in training, and in 2011 was honored with the Outstanding Outpatient Clinic Resident of the Year Award at UNLV. As Dr. Hadaji speaks, I encourage you to use the chat box to ask questions, as Dr. Hadaji will take live questions at the end of her talk. Dr. Hadaji, we're ready when you are.
Thank you so much, Leanne, and welcome everyone. Thank you for joining us today. So our topic of discussion today is going to be fetal alcohol spectrum disorders, which encompasses a group of conditions that develop as a result of prenatal alcohol exposure. This is a very important topic in the pediatric community as it affects thousands per year. And even here in Nevada, there is a significant population of children affected. It can go often undiagnosed, so it's really great to be able to bring attention to these disorders for more awareness and a better outcome for children who may be affected. So it's difficult to determine the exact incidence of these conditions, but it has been reported that up to 40,000 infants are born with fetal alcohol spectrum disorders every year. And just in Clark County, there has been reported up to 10,000 children affected. So it's even more prevalent than autism. This is not a hereditary or genetic disorder, and it only develops with alcohol exposure during pregnancy. So it's important to be aware of the incidence of fetal alcohol spectrum disorders, as half of all pregnancies are unplanned or unexpected. And surprisingly, 1 in 5 women continue to consume alcohol while pregnant. So the reasoning behind this might be the belief that only 1 drink is okay, or maybe some have even been told by a medical professional or a relative that occasional consumption of alcohol is not harmful to the fetus. However, contrary to this, absolutely no amount of any type of alcohol is recommended by any medical governing body to consume during pregnancy. In fact, out of all the substances of abuse and drugs, alcohol exposure to the fetus produces the most serious neurobehavioral effects. And so these conditions are 100% preventable by avoiding all alcohol consumption during pregnancy or leading up to conception. It's therefore recommended to just abstain from any type or amount of alcohol if a couple is trying to get pregnant, as some do not even find out their pregnancy status until several weeks after conception, and any amount of alcohol can potentially adversely affect fetal development. So it's just best to avoid all alcohol consumption. So fetal alcohol spectrum disorders encompasses a group of conditions, and there's 5 conditions or disorders that fall under this umbrella term. Maybe the most commonly heard is fetal alcohol syndrome, which is the most involved and the most severe form of this group of disorders, including not only behavioral, cognitive, intellectual, emotional delays, but also neurological disorders, distinct physical signs that we'll go into a little bit later, such as facial abnormalities, as well as growth problems, including poor weight gain and poor or short stature. Partial fetal alcohol syndrome describes an infant or a child that does not meet all the criteria for full fetal alcohol syndrome, but has some of the features and abnormalities in this category. The next category would be that falls under the spectrum disorders is alcohol-related neurodevelopmental disorder. These children do not have the outward physical or growth problems, but do suffer from intellectual, behavioral, and academic problems due to abnormal development of their brain and neurological system. Neurobehavioral disorder associated with prenatal alcohol exposure. This specifically affects thinking and memory in the child and causes difficulties with daily activities such as bathing, dressing, and can lead to behavioral problems, including aggression and impulse control issues. Lastly, alcohol-related birth defects. So this describes when the fetus is affected in terms of their physical organs, and it results in physical organ abnormalities of the kidneys, potentially the heart, the bones, and possibly the spine, the brain, and it can affect both vision and hearing. So what are the symptoms of these conditions? So in infancy, the baby can present with difficulty feeding or sucking and have a poor suck. They can exhibit sleep disturbance, possibly irritability, present with a smaller than average head, and also have trouble with gaining weight properly. In older children, once they start academics, you may notice academic difficulties, problems with attention, not being able to pay attention properly, and being inattentive. Behavioral problems, including emotional immaturity, memory problems. They can exhibit hyperactivity. They can have intellectual disabilities, as well as physical abnormalities, such as short stature, not gaining their ultimate height that they are predetermined to gain, as well as poor weight gain. They can have abnormal facial features that may be distinct, such as a smooth philtrum. So the philtrum is the ridge that is distinct between the nose and the upper lip in people. So in infants that are affected with this, or children that are affected with these disorders, they may have a smooth philtrum. They may have a thin upper lip. They can have an upturned nose and sometimes a smaller than average eye shape. So how do we diagnose these conditions? So unfortunately, there's no blood test or genetic test or any one tool that can diagnose fetal alcohol spectrum disorders. The diagnosis is based on a thorough prenatal and birth history, developmental history and evaluation, growth assessment, physical examination, which may reveal physical signs consistent with these conditions that we spoke about just a few minutes ago. Now, it's important to note that a verified history of maternal alcohol consumption is not needed for the diagnosis. The child is also going to need a comprehensive evaluation with a developmental specialist or pediatrician, a geneticist, and several other adjunct specialists are very helpful in evaluating the child's development, such as speech and occupational therapists. It's important to note that any of these conditions it's important to diagnose these conditions early on, and especially prior to age 6 to improve the overall outcome for the child. And many of these children can be affected and go undiagnosed or even misdiagnosed and don't receive proper resources at school to help with their academics, as well as outside of school to help with behavior and emotional problems, and they really suffer. So remember that only a small percentage, only 10%, have those distinctive facial features that we spoke about: the small upturned nose, the smooth ridge between their nose and their upper lip, the smaller than average eye shape, smaller head. And these symptoms tend to receive the most attention. However, the majority may not have these physical features consistent with this disorder, and they often go misdiagnosed or undiagnosed. And unfortunately, up to 35% of those that are affected end up in trouble with the law or even jail due to impulsive behavior and lack of proper judgment, which is attributed to their vulnerable emotional state at times and their cognitive problems. So it makes them easy to manipulate and coerce. So as pediatricians, it is really, really important. It's vital to ask a very thorough prenatal history, a developmental history of the child, evaluate the child's growth regularly, and ask about any possible alcohol exposure during pregnancy, and really try to make it comfortable for the parent to be able to, share those details with you. So this questioning and evaluation also is vital with the woman's OBGYN, who should be inquiring during prenatal visits about any alcohol consumption and providing appropriate counseling on abstaining from any consumption during pregnancy. So is there any treatment for these conditions? There is no one cure, and there's no single treatment for all these conditions that fall under fetal alcohol spectrum disorders, and these disorders are lifelong. So early identification, as we talked about earlier, and a comprehensive evaluation that starts with the pediatrician is paramount for the best outcome for a child's development. Here in Nevada, we can, and other states as well, we can refer to developmental pediatric specialists, a pediatric geneticist. We have Nevada Early Intervention and Child Find, which are state-funded programs that provide no-cost developmental evaluations, as well as resources to help with day-to-day functioning, such as occupational therapists to help with fine motor skills and behavior, as well as speech therapists to help with speech delays, and feeding therapists to help with any feeding problems in early childhood. So if any parents are concerned, of course, I recommend starting with your pediatrician, but you can also call Nevada Early Intervention or Child Find and let them know that you're concerned, and they will set up an evaluation for your family. There are also academic resources such as an individualized educational plan or an IEP that can hone in on the specific needs of the child during school and provide resources based on needs. All of these are very essential for the best potential outcome for the child. Medication therapy is also available for children with these conditions who are more severely affected by symptoms such as hyperactivity, impulse control, aggression, and behavioral problems. So depending on the severity of behavioral problems and symptoms, these medications can be initiated and discussed with the pediatrician, a psychiatrist, or a developmental pediatrician. So the resources that are available for families here in Las Vegas, as we discussed, Nevada Early Intervention is the state funded program for ages up to 3. And then Child Find is available for ages 3 and up. A great website is just for information regarding any symptoms or questions you may have regarding these disorders is www.healthychildren.org. And all these various conditions that fall under the spectrum are discussed there, and it's a good resource for parents. Also, it's important to address individuals who may have difficulty stopping drinking or suffer from addiction or alcohol addiction. Alcoholics Anonymous has a website at lvcentraloffice.org, and they have a hotline available 24/7, and it's listed on their website, as well as lists for resources for meetings, support groups, as well as therapy. Leanne, do I have any questions that I can answer for you?
Yes, I do have a few parents that were sending me questions, but first, thank you very much for that wonderful, informative talk. And we will be emailing out in a follow-up newsletter the resources that Dr. Hadaji mentioned. The follow-up newsletter goes to anyone who's registered for this or past event. It's also posted on the website in a couple of days. I'm a one-person office here, but it will be posted in a couple of days. So thank you very much. We had one parent ask, what do the longer-term side effects look like?
Yes, that's a great question. The question was, what do the long-term side effects of fetal alcohol spectrum disorders look like? So we kind of went into some of those symptoms in the talk, but just to summarize, there can be significant behavioral problems later on in life, such as inattention that can cause academic problems in school. It can cause difficulty maintaining jobs. It can cause memory trouble. It can cause permanent physical organ problems with the brain, the spinal cord, the neurological system, your kidneys, your vision, your hearing. And it does cause difficulty with impulse control. So children and adults later on in life, unfortunately, develop problems with the law in the future and can be involved in the juvenile system as early as age 10. They can suffer from social and emotional immaturity, and sometimes their emotional level is half of their age, and it can cause very difficult situations with interpersonal relationships, maintaining friendships, other types of relationships, and just difficulty with day-to-day functioning, like we said, holding a job position, friendships, relationships, and unfortunately can lead to drug abuse and alcohol addictions as well.
It's a very serious long-term. Thank you. We had one other question from a parent. So what can parents do to help kids, specifically teenagers, who don't want the help that the parents are trying to provide?
Yeah, so that's another great question, because sometimes we do get teens in our offices that might be a little bit resistant to help, and especially therapy and counseling. But I think it's very, very important to develop a trusting pediatric home and medical environment with your pediatrician. You want to involve therapists, psychologists, school administrators, the teachers, to provide resources for help specifically with academics, which can be frustrating in children who are affected with these disorders, and also resources for emotional support. You can, just like I said, be aware that emotional maturity may be at half the level of their age. So it's really important to advocate as the pediatrician, finding a therapist for the teenager who they may be comfortable with. You want to ensure that they're comfortable with, so they can feel free to open up and discuss what they're feeling. And there are actually free teen groups available through different resources here in Las Vegas, including Southern Hills Hospital Pavilion is a behavioral hospital. It's a wonderful new hospital located here in Las Vegas. And if you call them for resources, they actually do offer some free evening group sessions for teen support for various mental health disorders as well.
That's great. And I'll add that resource. And also, since we're statewide, for folks in the northern part of the state, you can always call Nevada 211 as well. And they should know if there are resources locally available in your part of the state for these type of support groups. So thank you again, Dr. Nadaji. Those were all the questions that I had for you today.
Thank you so much.
Certainly for communicating with your teens, we advocate family games and family walks, and that's what we're going to do now. So now it's time for us to take our walk, and here's how that's going to work. We're going to stop the live feed, but I, and hopefully all of you, are going to go outside with your families for a walk. I have to go wake up my teenager actually and drag him out with me. We welcome you to post photos of yourself walking on the Nevada AAP Twitter feed, which is at AAP Nevada. Please walk for at least 20 minutes, wear sunblock, carry water, and stay 6 feet away from other people not in your household. Also, keep a mask on kids 2 years and older, not yet vaccinated, in crowds. Next week, the Nevada AAP will be back for our Camine con un Doctor on Sunday, May 15th at 10 a.m. Dr. Jose Cucocon Calderon will give a Spanish language talk on the importance of preventative care for kids. And our next English language talk will be Sunday, June 12th at 10, and most likely will still be virtual. Have a great walk, everyone. Thanks for joining us.
Thank you. Happy Mother's Day.
Oh, yes, same. Happy Mother's Day.